So today our topic is UTI. Today our topic is UTI. So the questions in UTI, which stands for urinary tract infections. So they give you a clinical based questions like a patient, a male or a female. Generally, they give a female patient who is presenting to you in the OPD with increased frequency of urination and also increased urgency. But the most important point is the burning maturation. So they will give you a clinical case where a female presents to you in the OPD with the complaint of burning maturation with increased frequency and urgency. Then you have to diagnose that it is a case of urinary tract infection, UTI. Okay. The next question what they will ask is the causative agents. What are the causative agents of this condition, urinary tract infection? So for getting better marks, you have to uh, you have to tell about the organisms or the causative agents by classifying them. Like one classification is bacteria, other virus, then parasitic causes, then fungal causes of the UTI. So in the bacterial causes, we have the E. coli, which is causing about 70% of the UTI cases. So that is the most common uh, uh, cause of the UTI in our population in India. And next is the Klebsiella pneumoniae. Proteus species also cause the UTI, and Pseudomonas aeruginosa. So these four are the most important bacteria which are found to cause UTI very commonly in India. The viruses which very rarely cause the UTI, but yes, they also cause the UTI, are the BK virus and adenovirus 11 and 12. So they also cause the UTI, but not that much commonly. Next is the parasitic cause of the UTI. So parasitic cause is schistosoma hematobium, which is a parasite, yes, and tri Trichomonas vaginalis So these two are the parasites which are causing the UTI, and the fungus which is causing UTI is Candida albicans. So we see that in general practice, what have found that the most of the cases of the UTI are caused by the bacteria only, and these virus, parasitic, and the fungal causes are very minimum. They are very rarely found to cause UTI. So whenever the lab diagnosis is asked in the UTI, then you have to describe the diagnosis of the bacteria, okay, because they are most common than the viruses, parasites, or the fungi. So these are all the causative agents. Now coming to the types of UTI. So UTI has been classified anatomically into upper UTI and lower UTI. So upper UTI means infection occurring in the kidney and the ureter. eh, I have written it wrongly in the uh, beneath. So just see this arrow. This is like this, and this arrow is this. So upper UTI is affecting the kidney and ureter, while lower UTI, in lower UTI there that affects the urethra and the bladder. Okay. So up to ureter it is upper UTI. After ureter, that is bladder and the urethra, is the lower UTI. So that is the classification of the UTI. Anatomical classification is this. So this is the anatomical classification. Now coming to the pathogenesis of this UTI. So in short, we will read about the pathogenesis. Sometimes it is asked as a very short note in the structured long answer questions, which are very common nowadays. So pathogenesis sometimes asked, so we'll read it in a very short, in a very simple manner. So pathogenesis, in pathogenesis, the pathogenesis occurs via two routes. One is the ascending route and the other one is the descending route. Ascending route, see here, is constituting the maximum part of pathogenesis. That is 95% of the cases are by that ascending route pathogenesis, while only 5% cases are by the descending route pathogenesis. So ascending route pathogenesis are due to the infections from the urethra reaching to the ascending route, means the infections are reaching from the urethra to above. Okay, so urethra means how can urethra be infected? So urethra can be infected by sexual intercourse or by any instrumentation method like catheter institution may cause this infection in the urethra, and from urethra it may ascend up to the upper upper part of the urinary tract. Okay, and see what are the steps that occur, or what are the stages in which this bacteria reach to the infects the upper urinary tract. So first they colonize the first first the bacteria colonize the urethra. From urethra they ascend to bladder and it cause inflammation of the bladder, that is cystitis, and further ascend through the ureter and to the kidney, cause the pyelonephritis. Okay, so further from the ureter and kidney there is to cause ureter, there is to kidney, and they cause the infection or inflammation at the kidney, which is called as pyelonephritis. Now coming to the descending route. So in the descending route the infection reaches to the urinary tract via the hematogenous route, and for that we have to have the bacteria in the blood, that is called as bacteremia. So once there is bacteremia, then this bacteria may infect the kidney causing pyelonephritis. Okay, so this is the pathogenesis according through the this is the pathogenesis through or via the descending route. No, it is not like that. Once the patient gets the infection, there once the bacteria reaches there, there will always be the infection. Rather, we have some defense factors or mechanisms also, which inhibit the growth of the bacteria to certain extent. So that defense against those bacteria can be classified into the urinary factor and the mucosal immunity. Okay, so in the urinary factor we know that the urine is acidic, and the urine has a very high urine osmolality. The osmolality of the urine is very high. So these two factors inhibit the growth of pathogens. These two factors inhibit the growth of pathogens, and also the urine passes very rapidly through the urinary tract. This is called as mechanical flushing, and due to that mechanical flushing, there occurs that inhibits the colonization of the bacteria on the tract. So these are the urinary factors which are protecting us from the UTI. While mucosal immunity is also contributing to certain extent in providing immunity against those bacteria in the urinary tract, those mechanisms by the mucosal immunity are the production of mucosal IgA that inhibits the bacteria or the antigens, then TAM horsefall proteins that is secreted in the renal tubules. They also protect to certain extent, and the zinc which is secreted in the prostatic secretions. Okay, so these three factors provide the mucosal immunity and thereby prevent the growth of the bacteria in the urinary tract, and hence prevent the UTI to certain extent. Okay, this may also be asked as a short note, not short note, but yes, as a very short note they may ask this question for about 2 to 3 marks in short uh, answer questions or in the structured long answer questions. Next what they will ask is the lab diagnosis. So we will see the lab diagnosis next. So in the lab diagnosis, first what we do is the specimen collection. So first, anywhere in the microbiology we have to first collect the specimen. So first we will do the specimen collection. So specimen is collected in wide mouthed screw capped sterile container, because we do not want the urine to leak out to or spill over anywhere. Okay, because that may be a source of infection to other persons also. So it should be collected in a wide mouth screw capped sterile container, which if it is not it if it would not be sterile, then it may cause changes in the result. Okay, so there may be variations in the result, so that's why we need sterile container also, and wide mouthed, because it will be easy to collect the urine for the patient in that container, and screw cap to prevent the spilling over the sample. Next is the what is the preferred specimen then. So the preferred specimen is the early morning clean catch mid stream urine. Remember, all the words here are important. It should be early morning, it should be clean catch, it should be midstream urine. Okay, so whenever you are answering this question, what is the preferred specimen, always say this full sentence: early morning, clean catch, midstream urine. Next is the suprapubic aspiration. So that is the most ideal specimen, but it is not possible in all the cases to get this do the suprapubic aspiration and get the urine sample, because that is a cumbersome task and an invasive procedure. So we generally tend to avoid, although it is most ideal specimen, but this is tended to be avoided. And this suprapubic aspiration can be used for the patients who are in coma or in case of infants. Next is the in catheterized patients, urine जो है that is collected from the catheter tube. And for collection of urine from the catheter tube is first clamped distally. So first we clamp it distally, and then we suck the urine from the catheter tube in a sterile manner. So these are all the specimens that can be collected. One is the this early morning sample, this suprapubic aspiration, and in catheterized patient from the catheter. Now comes the transport of the specimen. Once we have collected, the specimen should be transported to the laboratory as early as possible. So the transport should be immediate. If any delay occurs, then the specimen should be refrigerated and should be stored by adding boric acid. Remember this, that if you have to wait, if the laboratory is closed, or due to any reasons the laboratory is due to any reason the sample has to be waited uh, for more than 24 to 48 hours, then yes, you have to refrigerate it, or either add boric acid and then store it. Okay, that will preserve the sample to certain extent for some time if the laboratory is closed, or for any reason it is not available. Next is the direct examination. So once we have got the sample, then first we go for the direct examination. There we produce a wet mount and we examine it under the microscope. So this wet mount examination is to found the pus cells in the urine. Okay, to found the pus cells in the urine. Then leukocyte stress test can be done. This detects the leukocyte stress enzyme which is secreted by the pus cell. So again, by this leukocyte stress test we can find the indirectly comment on the availability of the pus cells. Then gram staining. Gram staining is generally not useful because bacterial count in urine is very low. So finding the bacteria in through gram staining of the urine is very cumbersome task, very tough task. Next is our culture. So we have to, we have a list of bacteria we have seen earlier which may cause the UTI. So that's so we on the culture media we inoculate the urine and we um, put it into the incubator at 37 degrees C for 24 hours. So what are the media that we use? So see here, standardized inoculating loop is which can hold about 1 microliter sample is taken, and that is in, and using this inoculating loop, the urine is inoculated onto the McConkey agar and blood agar. So we take two plates, one is the McConkey agar and the other one is the blood agar. On both the plates we inoculate with the inoculating loop, and we will incubate the sample, incubate those plates at 37 degrees C for 24 hours. After 24 hours we see whether there is any growth or not. So if any growth occurs, then if it is a McConkey agar, then what are the characteristics of the colonies? By that we can predict the to or in other words we can say that we, by the characteristics of the colony, we can get a clue about the bacteria. We cannot we cannot say very strictly that this is this bacteria, but yes, we can get a clue about the bacteria, and that will make our path easy for further investigations. So in McConkey agar, if there is large, convex, smooth, translucent, and pink colonies, then probably this is E. coli. If it is, if in McConkey agar the colonies characteristics are large, convex, smooth, mucoid, and pink colonies, then probably the bacteria is Klebsiella pneumoniae. If the colony characteristic is large, low convex, pale colonies with fishy odor, then probably the bacteria is Proteus. And if there is diffuse growth, then probably the bacteria is Pseudomonas. Now coming to the growth on the blood agar. Coming to the growth on the blood agar. So in blood agar, if the in on the blood agar, if the colonies are golden yellow colonies with beta hemolysis, then the probably the bacteria is the staph aureus. And if there is non-hemolytic colonies with swarming, okay, with swarming, then probably the bacteria is Proteus. And if there is greenish diffusion of pigments throughout the blood agar media, then the bacteria may be Pseudomonas. So by these colony characteristics we can uh, predict to a certain extent about the bacteria from beforehand. Next, we do the gram staining by taking a colony from that agar media. Okay, so we perform gram staining by taking a colony. If in gram staining we find gram negative rods arranged haphazardly, then it may be E. coli and Klebsiella. If other gram negative bacilli are found, then it may be Proteus and Pseudomonas. If gram positive cocci is seen in clusters, then it can be Staph aureus. So by the gram staining also we get a clue. Next is the motility. So we check the motility by hanging drop method. That is very important method for undergraduate level. So by hanging drop method the motility is checked. So if the bacteria is motile, then it can be E. coli, Proteus, or Pseudomonas. If the bacteria is found to be non-motile, then it can be Klebsiella or Staph aureus. Any one can be the reason for the UTI. So this part is done. So that is what are the things we do with the culture. So we first produce, inoculate the culture media, we incubate it, then describe the colony characteristics, and based on the colony characteristic we get a clue about the bacteria. Then we do the gram staining. By gram staining we find a characteristic of the bacteria and get a clue about the bacteria, and by motility also we get a clue about the bacteria. Now next what we do, we do the colony count. Okay, we do the colony count. And for colony counting we know that in the urine the number of bacteria is very low. So so number of bacteria is very low. So we you remember we have talked about standardized inoculating loop. We have talked about the standardized inoculating loop, see here, which can hold about 1 microliter of urine. Now I will tell you why we have said it so, why it was so. So so inoculate we inoculate on a, in the urine the number of bacteria are very less. So all the bacteria form dis all the bacteria form discrete colonies. All the bacteria form discrete colonies like this. All the bacteria form discrete colonies like this. They form the discrete colonies. So suppose the standardized inoculating loop was capable of storing 1 microliter of sample. Now if in and we already have supposed that these all colonies are found by single bacteria. So there are 1 2 3 4 5 6. So there are 6 colonies in the media. Now if in 1 microliter of urine there is 6 bacteria, so see here, then we multiply it 1000 and we get the number of bacteria in urine per ml. And with this number of bacteria per ml of urine we can estimate whether the bacteriuria is significant or not. So suppose the count comes out to be, so we have calculated the number of bacteria in 1 microliter. Now we will calculate in, so we will multiply this 6 with 1000. Okay, we will multiply this 6 with 1000. And if it is okay, so multiply this with 1000 and we get a count of the bacteria in per ml of urine. Now that count, if that count is more than 10 to the power 5 colony forming unit per ml. Colony forming unit simply means one bacterium means one colony forming unit. So if the count is more than 10 to the power 5 colony forming unit means 10 to the power more than 10 to the power 5 bacteria per ml simply. So then we will call it as a significant bacteriuria. There may be uh, UTI. If this is so, then there may be UTI. If count comes out to be in between 10 to the power 4 to 10 to the power 5 CA colony forming unit per ml, then there is doubtful significance. We have to correlate clinically. It may not be UTI, it may be some other thing. If count comes out to be less than 10 to the power 4, then it has no significance. Yeah, this UTI may be due to the commensal bacteria. It has got no significance. Now after this we have to identify the uh, bacteria and surely say which bacteria is that. So for that we have to do some biochemical tests. uh, if Nowadays the biochemical tests in the laboratory are not done and they are detected on the basis of Malditoff and Vitek, but they can be identified with the conventional biochemical tests. and at undergraduate level these conventional biochemical tests need to be remembered. So see here, Pseudomonas, E. coli, Klebsiella, and Protease, and these are the test names: catalase test, oxidase test, citrate test, urease, and indole test. Okay, so how will you remember these all tests? So I have made a simple mnemonic, that is Kokui score, Kokui score. So the Kokui score of Pseudomonas is P3N2, of E. coli is PN3P, and of Klebsiella is PNP2N, and of Proteus is PNP2N. P3N2 means starting three tests will be positive and last two tests will be negative. So starting three tests are catalase, oxidase, and citrate. So these three are positive, and last two are urease and indole, they are negative. So Kokui score of Pseudomonas is P3N2, of Kokui score, COCUI. Kokui score of E. coli is PN3P. That means the first test is positive, catalase is positive, then three tests are negative: oxidase is negative, citrate negative, urea is negative, and the last fifth test is again positive, so indole is positive. Now the Kokui score of Klebsiella is PNP2N. So first test is positive, second is negative, then again two tests are positive: citrate, urease are positive, and indole is negative. And protease again has PNP2N. So first is positive, then second is negative, then two are positive, and the last one is negative. So by that, by this simple trick of Kokui score, and by remembering this Kokui score of the bacteria, we can simply remember the biochemical tests of important bacteria. I will make a separate video based on about this mnemonic, or you can say a trick to remember. So in that video I will describe it in detail about the Kokui score, just a trick to remember the biochemical tests of the bacteria. Next is the we can do catalase test also. That is not so significant because Staph aureus is not so commonly found to be causing UTI, but yes, we can do the catalase test and coagulase test. If they come out to be positive, then it may be Staph aureus. Okay, next is the antimicrobial susceptibility test. So antimicrobial susceptibility test we do by the disk diffusion method on the Muller-Hinton agar, MH agar, what we call as MH agar, Muller-Hinton agar, and the procedure is the disk diffusion method. So why do we do this antimicrobial susceptibility testing? Nowadays very much of resistance is seen in the bacteria, uh, because of which the patients or the bacteria do not respond to the normal antibiotics. So we have to treat those infections with some specific antibiotics to which they are resistant, and to find to which antibiotic those bacteria are resistant, we have to perform the antimicrobial susceptibility test. So with the antimicrobial susceptibility test we find that which bacteria, I mean which organism is resistant to which antibiotic. So we give that antibiotic and we treat the infection. So that's why this antimicrobial susceptibility testing has become very much important nowadays, because the use of antibiotics is very randomly occurring these days. So resistance is developing very quickly in the bacteria, so that's why it has become now very important. So this helps in treating the UTI patients appropriately. We can give the proper treatment or specific treatment. So this is all about the diagnosis of UTI. If any queries, then comment it down. This is all about UTI.